Hi, my name is Faye Stahl, and I will be going over the case study and the ethical principles that are in conflict. So, to start, we are a primary care physician team, and we are treating Mr. Thompson, who is a 62-year-old man with severe type 2 diabetes. Over the last year, his condition has worsened significantly, leading to early stage kidney failure. And despite our repeated warnings, he has not changed his diet or taken his insulin consistently. And he has stated, I've lived my life this way for 60 years and I am not stopping now. But today he presents with a foot ulcer that is severely infected. He refuses the recommended course of intravenous antibiotics and a minor surgical debridement, insisting that he just wants a quick cleaning and to go home. And ultimately, if it is left untreated, the infection will most certainly lead to amputation or sepsis. So to start off, the first principle we found in conflict was autonomy, which is the right of a patient to make their own informed decision about medical care, free from coercion. However, the patient must also have the capacity to understand, retain, and weigh the information to make the proper medical decision. Additionally, we also found that non-maleficence and beneficence were in conflict because allowing him to not undergo the recommended course of treatment could lead to serious infection, sepsis, and then possible amputation. And ultimately, we found that justice was not as big of an issue because this case study does not directly deal with unequal access to medical treatment.
Hi, I'm Caitlin Cronin, and I will be talking about the next steps and later providing ethical justification. So, firstly, we're not sure if Mr. Thompson is in the right mental capacity to make a decision. Because he has an infection, it could be clouding his judgment. And because of that, we would like to see if he can bring in a family member and that we can talk to them and that he can help or they can help talk to Mr. Thompson about the situation and convince him to get the antibiotics and surgical debridement. We would also like to see if we can at least just do the cleaning and give him antibiotics because if he's unwilling to get the surgical debridement, we at least want to help him try to get out of pain. We would also recommend that he continues to get or to come in for checkups so we can monitor his infection and make sure it doesn't lead to amputation or sepsis since he is declining the recommended treatment. And then if all of those are declined, we would like to just prescribe him with antibiotics.
Hi, I'm Eli. So the outcome we're hoping for is, of course, once we are able to get in contact with family or friends or any sort of proxy who might be able to convince him. Because one concern of ours is he might have some sort of bias towards the healthcare system or just any sort of feelings of discomfort. So ideally, those people would be able to convince him to get the course of antibiotics or surgical debridement. However, if that's not possible, we will just go ahead and go with the cleaning. And hopefully, when he comes in for follow-ups and like regular cleanings, he'll slowly be a bit more convinced that this isn't something that can really just go away, and he'll slowly just become more accustomed to the hospital, feel comfortable enough to go with the procedure.
Hi, my name's Cayenne, and I'm going over what you would do if that was not the outcome that we achieved. So at that point, we would then just do the quick cleaning that he stated that he would receive without much pushback. We would also prescribe antibiotics to hopefully help reduce the infection. And as stated before from both Caitlin and Eli, we would want him to have continued checkups for this foot ulcer that is severely infected. That way we can keep monitoring his health and making sure that no more drastic events would have to take place.
With our next steps and potential outcomes, autonomy is respected because we are still trying to do what he wants, but we are hoping that his family member can help him make the decision on his own because we cannot force him. With the non-maleficence and beneficence, we are hoping to at least treat him with antibiotics at the minimum, which will help him stay out of some harm and some of the pain that he's in. And it is our duty to respect his autonomy, but still help him in the best way that we can. So if he is choosing to leave, we will have to just do a quick cleaning and prescribe him antibiotics so that he at least has something. And we also looked at virtue ethics, and with that, the ability to determine like what is right in specific situations is part of virtue ethics. And we have said that we think that he needs to get this treatment, and we're hoping that we could educate him more about what happens if the infection goes untreated so that he understands the depth of the situation, because he might just think that it won't happen to him. And we want him to understand the signs of it if it gets worse so that he can come back in on his own and that we can still help him in the best way possible.
Yeah, and then through an ethical lens of deontology, we as healthcare providers obviously have our code of ethics, and we want to make sure that non-maleficence, which is do no harm, we don't want to harm him anymore, and that we also want to act in the best interest of our patients. And in this case, it would be getting him getting the full treatment. And we'd also have to respect his autonomy and adhering to like all of our code of ethics. It's kind of like a 2 to 1 kind of situation, but obviously there's more to it. But we would just have to be aware of all the consequences and our own obligations as healthcare providers to provide him with the best care possible within our code of ethics and outlines.
We would also like to talk to him because if he's just scared, we want to see if we can help him overcome that fear if that's what's holding him back, since we're unsure right now. And after that, we can help make a better decision about the situation.
Also through like a care ethics perspective, obviously with like empathy and compassion, we don't want to like force him to do anything that would cause him too much discomfort, but it's also important to us that we provide him the best care possible in order to allow him to like fully recover and maintain the lifestyle that he wants to keep up with, since clearly he's having struggles with changing his diet. We want to do our best to at least minimize change that you would have to experience.
Thank you so much for listening to our case study.